Hello and welcome to This Explainer. If you're joining me today, chances are you or someone you love is navigating the deeply personal and sometimes exhausting journey of fertility care. And honestly, I am so glad you're here. Today, we're going to walk through this together. We'll be looking at the science of genetic testing in fertility care, but absolutely not as a list of intimidating medical terms. Think of This Explainer as your roadmap to hope. We're going to break down exactly what these tests are, why they're used, and how they can actually give you and your doctor the clarity you need to move forward with total confidence. Before we get into the clinical science, I just want to take a second to acknowledge the emotional weight of family planning. The fertility journey, well, it's often filled with a lot of questions, a fair bit of waiting, and yeah, sometimes a little anxiety. It is completely normal to feel overwhelmed when you're suddenly faced with advanced medical options and complex jargon. But the really beautiful thing about modern medicine is that you do not have to navigate the dark alone. The tools we're going to look at today are specifically designed to shine a light on your unique path. We're talking about turning the unknown into actionable, empowering knowledge. Okay, let's dive into this. Section 1, a supportive fertility guide. Let's start by looking at this entire process as a simple roadmap, because when we break down these complex medical tests step by step, they suddenly become much less intimidating, right? They're more like friendly signposts pointing you in the right direction. To truly understand our roadmap, we first need to define what we're actually looking at. In the context of fertility, think of genetics simply as an instruction manual or, a biological blueprint. Every single cell in our body relies on this manual to know how to grow and function. So, when fertility doctors use genetic testing, they aren't looking for flaws to judge you by. They are simply reading your unique blueprint. They just want to understand the instructions guiding your body so they can ensure the absolute healthiest start possible for a future pregnancy. It's really all about gathering the right information. Moving right along to Section 2, why use genetic testing? So now that we know we're just reading the biological blueprint, you might be wondering, well, why do we need to read it in the first place? The benefits of genetic testing are profoundly positive. Rather than seeing these tests as scary hurdles to cross, it's incredibly helpful to view them as proactive tools. First and foremost, genetic testing personalizes your unique fertility treatment. You aren't a statistic, and your care shouldn't be either. By understanding your genes, doctors can actually improve your overall chances of achieving a successful pregnancy while actively limiting the risks of complications. And perhaps most reassuringly for a lot of couples, these tests can finally uncover the reasons behind past heartache, things like previous miscarriages or implantation failures. It essentially replaces that lingering fear of the unknown with actionable, highly customized care. Which brings us to Section 3, screening for the parents. So, where does this roadmap actually begin? Well, our first major stop is screening for the parents. This is where we look at the building blocks that you and your partner bring to the table. Now, one of the first tests you might hear about is called karyotyping. I know, it sounds highly technical, but let's de-jargonize it for a second. Karyotyping is basically just taking a step back to look at the big picture of an individual's chromosomes. It's a structural overview. Your doctors just want to make sure that the proper number of chromosomes are there and that they're structured correctly. Think of it like making sure all the right chapters are present in your genetic instruction manual before actually reading the specific pages. Another absolutely crucial tool at this stage is carrier screening. This is a very common and honestly highly reassuring test. It simply checks to see if a person carries a hidden gene variant, basically a slight modification in their DNA that could potentially be passed down to the next generation. Actually, fun fact, many of us are carriers for certain genetic traits without ever knowing it. On average, literally every single person is a carrier for a handful of genetic conditions. But because it doesn't affect our own health, it just remains hidden. By identifying these hidden variants proactively, your medical team can ensure a completely safe path forward for your future baby, making sure you avoid the transmission of specific genetic disorders. Now, what's really interesting here is how these different test types act kind of like different lenses your doctor can use. Depending on your family history, doctors have different tools that allow them to zoom in or zoom out on your genetic blueprint. If you already know of a condition running in your family, say Fragile X syndrome, they're going to use specific disorder testing to zoom right into that single gene. If a problem is suspected but the exact cause is kind of a mystery, they zoom out and use genome-wide screening. And if they need a highly detailed scan to check for tiny extra or missing pieces of genetic material across the board, they'll use a chromosome microarray. It's really all about having the precise tool for your exact situation. Let's shift gears a bit to Section 4, understanding male factor tests. Our roadmap isn't just about the female experience, obviously. When it comes to the male biological building blocks, the sperm, there are highly specialized ways to ensure everything is optimized. Now, these terms can sound a bit intimidating if you see them on a clinic brochure, but let's demystify them. The Y chromosome microdeletion test, it simply checks for tiny missing pieces of genes on the Y chromosome that might be slowing down or stopping sperm production. Sperm DNA fragmentation basically measures if there's any physical damage or breaks within the sperm's DNA strands. And finally, sperm aneuploidy screening just counts the chromosomes within the sperm to ensure there are no numbering errors. At the end of the day, all these tests serve one really simple purpose: making sure we're starting the process with the absolute healthiest, most robust components possible. I really want to emphasize the why here. Look, if one of these male factor tests comes back flagging an issue, it is absolutely not a roadblock. It's actually the exact opposite. Discovering an issue is the key to unlocking the right treatment. These tests empower your doctor to bypass generic advice and determine exact, customized treatment options tailored to that specific finding. It gives you a clear, personalized strategy. Okay, let's move to Section 5 and see how this builds. Section 5, guiding the embryo transfer. So, once we've checked the building blocks from both parents, we move into the final crucial steps of our roadmap, which involve the embryo itself and the environment it's going to grow in. Up until this point, we've been talking about testing the parents, checking the inherited traits before anything is combined. But modern fertility care allows us to take an incredible step further with pre-implantation genetic testing, or PGT for short. PGT allows doctors to gently and safely evaluate the newly created embryo itself, long before it's ever transferred to the uterus. This ensures that the specific embryo chosen for transfer has the correct chromosomal structure, which greatly increases the likelihood of a successful, healthy pregnancy from the very first try. It's a real game changer. And, even with a perfectly healthy embryo, timing is literally everything. That's where endometrial receptivity testing comes in. This test focuses entirely on the uterus. It assesses the uterine lining to identify your body's absolute optimal window for accepting an embryo. Think of it as the ultimate preparation step. We have the perfect blueprint, we have the perfect building blocks, the carefully evaluated embryo, and now this test ensures the environment is perfectly timed to welcome it. Finally, Section 6, taking your next steps. As we bring our roadmap to a close, let's talk about what all of this information means for you, right now, in practical terms. Like, what exactly should you expect when you walk through the doors of a fertility clinic? So the crucial point is you do not need every single test we talked about today. The process is much, much more thoughtful than that. It starts with an initial consultation, followed by a deep dive into your specific reproductive and family history. From there, your doctor is going to curate a highly personalized testing plan requested just for you. They will only use the specific genetic tools that make sense for your unique story, ensuring you get exactly the answers you need without any unnecessary stress. We've covered a lot of ground today, looking at how genetic testing acts as a powerful, proactive tool. It removes the guesswork and replaces it with science, strategy, and above all, hope. As you look toward building your future family, I want to leave you with this thought. Knowledge isn't just power. In fertility care, knowledge is profound peace of mind. So which of these proactive steps will give you the most peace of mind on your journey? Remember, every single question you ask your doctor and every test you choose to take is a beautiful step forward. You have the tools, you have the knowledge, and you are entirely capable of navigating this. Thank you so much for exploring this with me today.